Blood clots can happen silently, and by the time you notice them, it might be too late. Every year, thousands of people suffer from blood clots without warning, especially after the age of 40. But here's the truth. Are you sitting too long? Not drinking enough water? Ignoring simple daily habits? In the next few minutes, you'll discover simple habits that could literally save your life. So make sure you watch until the end. Create a YouTube video, 16:9, using this script. Table of contents. 1. The silent threat: understanding the danger of blood clots. 2. Why age amplifies the risk: the inevitable march of time. 3. The hidden culprits: common risk factors you can't afford to ignore. 4. Listen to your body: the critical warning signs of a blood clot. 5. Your proactive prevention plan. 7. Doctor-approved daily habits. 6. Making it stick. 7. The power is in your hands. A final call to action for your health. Section 1. The silent threat. Understanding the danger of blood clots. Blood clots can happen silently. They can happen without a single warning. By the time you notice them, it might already be too late. Remember that. Many people develop dangerous blood clots with no obvious signs. The good news: most of these silent threats are preventable. Small, simple daily habits can make a monumental difference. You hold more power over this risk than you think. It starts with understanding and controlling your daily choices. Let's break it down. What is a blood clot? A small, thick clump of your own blood. Your blood should flow smoothly, like a river through your veins. But it can become sticky. That sticky blood can form a little plug, or a dam inside a vessel. Sometimes that's helpful. It stops bleeding from a paper cut. But when clots form deep in veins or arteries for no reason, they block vital blood flow. A clot in your leg, deep vein thrombosis (DVT), can break free and travel to your lung. That's a pulmonary embolism, a deadly medical emergency. Why are early signs missed? Many initial symptoms are subtle. A little bit of pain, some minor swelling in your leg. You might think you pulled a muscle during a workout, or that you just bumped into something. Others feel sudden shortness of breath, and blame it on being out of shape, or on a busy, stressful day. Our hectic lives plus mild symptoms often delay medical care. That delay can cost you your life. Section 2. Why age amplifies the risk: the inevitable march of time. As we grow older, our bodies undergo natural changes. Our risk for certain health conditions, including blood clots, begins to increase. Let's talk about why this happens. As the years go by, the intricate network of blood vessels that carries life-giving blood can change. The walls of your veins and arteries can gradually lose youthful elasticity. They can grow more stiff and rigid. Visual comparison. At the same time, the tiny valves inside your veins can weaken. This combination can cause your blood to move more slowly, or to pool, especially in your lower legs. Sluggish blood flow is a major invitation for clots to form. It's not just the vessels themselves. As we age, we're more likely to develop other underlying health problems. Heart disease, certain types of cancer, diabetes. Each of these can independently raise your chances of developing a dangerous clot. Many older adults also undergo surgeries: hip replacements, knee replacements. These surgeries involve periods of immobility that dramatically increase risk. This is why paying close attention to clot prevention becomes especially vital after 40. But remember, while the risk climbs with age, clots can occur at any age. This increased risk is not a cause for panic. It is a clear call for increased awareness and proactive care. Think of it as a journey. As you travel further down the road of life, be a more attentive driver. You need to perform more regular maintenance on your vehicle, your body. The natural aging process is something we cannot stop, but we can absolutely take intelligent, deliberate steps to counteract its effects on circulation. Understanding that age itself is a risk factor allows you to be more vigilant. It allows you to adopt preventative habits earlier, and to have more informed conversations with your doctor about your personal risk profile. See this connection not as a sentence, but as an opportunity. An opportunity to take your health more seriously than ever before. Double down on healthy habits that support your entire cardiovascular system, from your heart to your smallest capillaries. The changes that come with age are gradual, which means you have time to adapt and respond. By acknowledging this heightened risk, you empower yourself to take meaningful action. Section 3. The hidden culprits. Common risk factors you can't afford to ignore. Beyond the unstoppable factor of age, there are many other hidden culprits, everyday habits and conditions. One of the biggest offenders in our modern world is prolonged sitting. Stuck at a desk for 8 hours a day, binge-watching your favorite television series, buckled in for a long flight or car ride, staying seated for hours on end is incredibly dangerous for your circulation. When you sit still, the muscles in your lower legs are not contracting. They are not helping to pump blood back up to your heart. Blood can then pool in your lower extremities, creating the perfect stagnant environment for a clot to form. Another major risk factor many people underestimate is dehydration. Not drinking enough water throughout the day can have a profound impact on your blood. Your blood is mostly water. When dehydrated, plasma volume decreases. That makes your blood thicker, more concentrated, and stickier. Think of it like a sauce simmering on the stove as the water evaporates. The sauce becomes thicker. Thicker blood flows sluggishly and is far more prone to clumping and forming a dangerous clot. This is why staying consistently hydrated is one of the easiest, most effective preventative measures you can take. We also can't ignore lifestyle choices. Smoking is a huge one. Cigarette smoke contains thousands of toxic chemicals that damage the lining of blood vessels, creating rough patches where clots can form. Smoking also makes your blood platelets stickier. Carrying extra weight is another major burden on circulation. Obesity puts constant pressure on the veins in your legs and pelvis, damaging them over time and impeding flow. It also promotes chronic inflammation, a known trigger for clot formation. Your diet plays a role too. Diets high in saturated and trans fats harm vascular health. Finally, specific medical conditions can place you in a high-risk category. A personal or family history of blood clots is a major red flag. Active cancer and its treatments, such as chemotherapy, significantly increase clotting risk. Major surgery often requires bed rest that slows circulation. Hips, legs, abdomen, heart failure, inflammatory bowel disease. Certain inherited genetic disorders can also predispose you to forming clots. Knowing if you have any of these underlying risks is crucial. It lets you and your doctor create a targeted prevention strategy that may include medication alongside lifestyle changes. Your body has a remarkable ability to send you signals when something is wrong, but you have to be willing to listen. When it comes to a blood clot, ignoring these signals can have devastating consequences. The most common location for a clot to form is in the deep veins of the leg, a condition known as deep vein thrombosis. One of the most classic warning signs is swelling in just one leg or arm. If you look down and notice that one of your calves' ankles thighs appears noticeably larger or more swollen than the other, this should be an immediate red flag. This swelling occurs because the clot is acting like a dam, blocking normal blood flow and causing fluid to back up in the limb. Along with swelling, you should be on high alert for any new pain or tenderness in one of your limbs, particularly in your calf. This pain is often described as a cramp, a Charlie horse that you can't seem to get rid of. It might feel sore to the touch, and the pain may worsen when you are standing or walking. It's crucial to remember that this pain is not typically caused by an injury. If you develop a persistent, unexplained pain in your leg, do not just assume it's a simple muscle strain and try to walk it off. This is your body's alarm system, and you need to heed the warning and seek medical evaluation right away. Another key sign to watch for is a change in your skin. The area over the clot might feel warm to the touch compared to surrounding skin. You might also notice a distinct change in skin color, reddish pale bluish tinge. This discoloration is a direct result of the disrupted blood flow in the area. A combination of swelling, pain, skin changes in a single limb is a hallmark triad of symptoms for a DVT. This constitutes a medical situation that requires immediate attention from a healthcare professional. The most dangerous scenario is when a piece of the clot breaks off and travels through your bloodstream to your lungs. This is a pulmonary embolism and its signs are different. The number one symptom to watch for is a sudden, unexplained shortness of breath. You might feel like you can't catch your breath, even while resting. This can be accompanied by sharp chest pain that gets worse when you take a deep breath or when you cough. You might also experience a rapid heart rate, lightheadedness, or even cough up blood. These are signs of a life-threatening emergency. If you experience any of them, you must call 911 or get to the nearest emergency room immediately. Now for the best part, the simple, powerful actions you can take every single day to dramatically lower your risk of developing a blood clot. The first and most important habit is to move your body frequently. Your calf muscles are your second heart, helping to pump blood out of your legs. If you sit for long periods, set a timer on your phone or computer to remind you to get up every 30 to 60 minutes. Stand up, walk around your office or home for a few minutes, and do some simple stretches. When you are stuck in a seat on a plane or in a car, consciously perform ankle pumps and foot circles every hour to keep the blood moving. This simple act of breaking up sedentary time is incredibly effective. Second on the list is to stay well hydrated. This cannot be overstated. Make drinking water a consistent habit throughout your entire day. Carry a reusable water bottle with you everywhere you go as a constant visual reminder. Aim to sip water steadily, rather than chugging a large amount all at once. Be mindful of your intake of dehydrating beverages like alcohol and excessive caffeine. A good rule of thumb is to check the color of your urine. It should be a pale, straw-like yellow. If it's dark, it's a clear sign that you need to be drinking more water to help keep your blood thin and flowing smoothly. Third, make regular walking a non-negotiable part of your routine. You don't need to run a marathon. Consistency is far more important than intensity. Aim for a brisk 20 to 30-minute walk each day. You can break this up into 2 or 3 shorter 10-minute walks if that fits your schedule better. A short walk after a meal is a fantastic habit that aids digestion and boosts circulation. Whenever you have the choice, take the stairs instead of the elevator. Walking is a low-impact, highly effective way to engage your leg muscles, improve overall cardiovascular health, and keep your blood from becoming stagnant. The final 4 habits are interconnected pillars of a healthy lifestyle. Eat a heart-healthy, anti-inflammatory diet rich in fruits, vegetables, and whole grains. Focus on getting healthy omega-3 fatty acids from sources like fatty fish, flax seeds, and walnuts. At the same time, work to maintain a healthy weight to reduce the physical pressure on your veins. If you are a smoker, there is no single better thing you can do for your health than to quit. Your clot risk begins to drop almost immediately. Lastly, if you have known risk factors, follow your doctor's advice meticulously. This may include taking prescribed blood-thinning medication or wearing compression stockings, especially during long periods of travel or recovery from surgery. Knowing what to do is the first step, but the real challenge is turning that knowledge into lasting, automatic habits. Start small, make the new behavior as easy as possible to incorporate into your existing routine. If your goal is to move more frequently at work, don't just rely on willpower. Use technology to your advantage. Set a recurring alarm on your smartphone, or set a calendar reminder on your computer. Let that cue pop up every hour with a simple message: time to move. That external cue removes the need to remember on your own, making it much more likely you'll stand up, stretch, and walk around for a few minutes. To make hydration a habit, make water visible and accessible at all times. A bottle on your desk in plain sight makes sipping much easier. Get a bottle you enjoy, keep it filled. Try habit stacking. Link the new habit to something you already do. Every time I check my email, take a sip of water first. Before making your morning coffee, drink a full glass of water. Finding social support can be a game changer. Ask a friend, a family member, or a coworker to join a daily walk, or join a local walking group or a fitness class. For diet, replace one unhealthy snack a day with a piece of fruit or a handful of nuts. Small, manageable changes build momentum. Be patient with yourself, focus on progress, not perfection. If you miss a day, don't give up. Get back on track the next day. Celebrate small wins. Each time you choose the stairs, drink a glass of water, or go for a walk, you're voting for your future health. These small, consistent actions build a resilient, clot-proof lifestyle over time. The ultimate message I want to leave you with today is one of empowerment. Prevention is always easier and better than treatment, especially when it comes to something as serious as a blood clot. Your health tomorrow is being actively shaped by the small, seemingly insignificant choices you make today. While you cannot control your genetics or the natural aging process, you have profound control over so many of the risk factors we have discussed. You have the power to move your body, to hydrate yourself properly, to nourish yourself with healthy food, and to avoid habits like smoking. Start with just one of these habits, just one, and build from there. The journey to a healthier you begins with a single deliberate step. It is also vital to be a proactive partner in your own healthcare. If you notice any of the warning signs, unexplained swelling, pain, skin changes, or shortness of breath, you must be your own best advocate. Be clear and direct with your doctor. Tell them exactly what you are experiencing and share any personal or family history of blood clots. Ask specific questions. Given my upcoming surgery, what is our plan for clot prevention? Or, based on my lifestyle, do I need any specific tests? Your doctor is your most valuable resource, but they can only help you effectively if you provide them with all the necessary information and ask the right questions. Your life, quite literally, is in your daily habits. Please, do not wait for a frightening warning sign to jolt you into action. Do not wait for a medical emergency to wish you had done things differently. The time to protect yourself is right now, today, in this very moment. You can start by simply standing up from your chair after you finish reading this. You can go and fill a glass with water. You can decide that starting tomorrow, you will take a short walk during your lunch break. These small steps, repeated day after day, are the foundation upon which a long and healthy life is built. They are your personal insurance policy against this silent threat. So, I urge you to take action. Take control. The power to prevent a deadly blood clot is not in a futuristic pill or a complex medical procedure. It is in the simple, consistent choices you make every single day. One small step taken today can make a world of difference for your tomorrow. Start now. Your future self will thank you for it. Choose to move more, drink more water, eat better, and be vigilant. Your health is your greatest treasure, and it is worth protecting with every step you take. Subscribe for more simple health tips that could save your life.